All right, and we are live. I'm so excited to be here today. Good morning, good afternoon, good evening, depending on when you're watching this. I
Mhm.
am Dr. Ola Benton of Living Spring Family Medical Center, where we help you live long and well because we believe the quality of life is just as important as the quantity of life. And I'm excited to be here with the awesome Dr. Catherine Toomer.
Hello.
And I'm going to give you a second to introduce yourself, but I'm so honored to have you here. And I wanted to give you a shout out and say thank you for gracing us with your presence. All right.
Well, thank you for having me.
All right. My pleasure. Now, that being said, please do the honors of introducing yourself. Who are you and what do you do?
Ooh, that's a lot. Okay. Well, I am Dr. Catherine Toomer, and I am a family medicine and community health physician who founded health, wellness, and weight loss centers 5 years ago as a reaction to the being unable to help my patients in the way I wanted to prevent chronic disease using weight loss. I
Okay.
myself created the program because I lost my own 60 pounds 20 years ago and another 25 since. But I was unable to use my program in the way that I wanted in a typical clinical setting. And so I
Okay.
started my own practice and, um, and I've been helping people ever since.
Awesome, 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 awesome. And I love the fact that you were able to transform your own personal story,
Hmm.
your own personal experience into helping people. And I think people can relate more to when you can share in their experience. So
Yes.
I'm happy you do that. Now, I know you highlighted some of it in your introduction, but why do you do what you do? What was the turning point for you?
The turning point was 20 years ago. I was morbidly obese and a physician trying to tell patients to be healthy, and I myself was very unhealthy. I was an insulin dependent diabetic, and then I had my daughter. And a month after, I was diagnosed with what's called a postpartum cardiomyopathy, which essentially means I went into heart failure. My ejection fraction was 15%, which is normally about 55 to 65%. And I was given a 50% chance of living 5 years. I had a 2.5-year-old, a 1 month old, and if anyone knows anyone who's had congestive heart failure, you know it's a very debilitating experience. You can't breathe, you can't walk, you can't do anything. So I was 100% dependent on other people, and I knew I needed to do something if I was going to survive. And so I decided to lose weight. That was the only thing I had control over: get my diabetes under control and to lose weight in the process, or one or the other. And
Wow.
but when I went for help at what were some of the more popular weight loss centers, I was told I was too high risk because of my heart, and that
Heart.
concerned me because I thought, how could a weight loss center not be healthy for someone with a heart condition? And so I started doing it on my own. I had studied a biopsychosocial system in medical school and residency, and so I went back to that. I studied my endocrinology. I studied, which is basically what diabetes falls under.
Right. Right.
And so I just started making little changes because I was just exhausted. I couldn't do big things. So I made little changes and I started documenting the things that really worked, that made a difference to my blood sugars, the things that made a difference to my energy levels. And I put it all together. And then 6 months later, I was 60 pounds lighter. My diabetes was under control. I was off insulin. And I thought I might have something here, but I was still, recovering from my heart. So I just kept developing the program and kind of seeing what worked and what didn't. And over the years, and then I put it together into a program, and that's what I use now. And I've survived, obviously. I was 36 years old then. I'm 56 years old now.
And you're looking
Um,
good, Doc.
Thank you. And so, I mean, it worked. And so I started helping other people with that, even more so once I went out on my own. And it really was working. I mean, from all ages, people telling me I'm 70 years old, I can't lose weight. And I helped them in a way that was healthy. Their back pain was going away, their knee pain, because I'm a physician first. So it's more about symptoms than weight, really. Weight is a symptom in and of itself, as you know. And so I say weight loss, but really the weight is the symptom that I go after because I know it represents other things that are
Mm,
there. And usually they're emotional things, they're psychological things, they're also biological things, but then there's also social things. And we're going to probably talk a little bit about that today,
mhm,
actually, because we're talking
mhm.
about holiday eating. So that's
Yes.
social eating is a big deal this time of year.
Wow, awesome, awesome. And for those
Yeah.
who are watching, who yeah, I just want to highlight a few points that you made. Well, actually, you made quite a few
Mhm.
points. Um,
Sorry, I
congestive,
talk a lot.
postpartum cardiomyopathy. It's when the heart is
Hmm.
not able to pump effectively, and so blood flow to all your vital organs, all your organs is cut short, and so you're tired easily. You get short of breath. You get
Hmm.
winded. And I can imagine that having had two kids, I'm sure that was very
Hmm.
hard to manage. But I'm happy that you're able
Very.
to transition out of that.
Hmm.
So I don't know what heart condition or what medical condition. Of course, you do this guided with your physician, but it is possible to transform. The body is
Hmm.
amazing in that it's able to adjust as you make changes to
Hmm.
help you feel better. So don't give up, whoever's watching. Now, my next question is this, and this is one of the things I loved about reading your website and reading about you and even getting to know you, is that one of the things unique to you is your emphasis on the why. It's not just I want to look a certain way. It's, well, why is your weight, why the weight gain? So you look for the cause as well. And one of the quotes on your website I love is that I listen for all the ways I can help you lose weight. So could we talk a little bit about that? Why, like, how did you get to that point? And
Hmm.
in your working with patients, why have you
Hmm.
seen that to be important?
Okay. Well, one of the things I like to say, and this is also in my website, is that I listen for the whisper behind the words.
Hmm.
Because people come and say, I want to lose weight. And even I want to look a certain way is still a reason. And
Fair,
it's
yeah.
whatever your reason, whatever motivates you to want to be healthy, to want to be a certain way, that is a good reason. If it's your reason, it's a good reason. But usually when people want to look a certain way, there's some other thing behind it. Either there's a relationship they're trying to change, or there's a feeling they're trying to get rid of, or there's a feeling they're trying to gain. And so I look for those things because that's where the motivation is.
Hmm.
That's what I use to help people get the results they want. And so in my talking, I just realized I forgot your question. I'm sorry.
You're doing good because you answered the question though. The question is like,
Okay.
why? Why that
Yeah.
approach? And in working with
Okay.
patients, like, why have you seen that to be
Mm.
helpful? And you're
Well,
answering it.
yeah. Okay, good. Because as I was talking, I realized I was like, because I do that sometimes. I get so excited about the information, I forget the question. And so, but why is important. And the reason I look for the why is because if someone had asked me at the beginning of my journey, why are you trying to lose weight?
Hmm.
And it would have been easy to say because I have two small children, because um, I have two small children. That should have been motivation enough. But I found that I couldn't get myself to do the things I needed to do.
Hmm.
And so it turned out that my why was more, I just didn't want to die. And it wasn't for any other reason. And even that I found difficult to stay motivated. But
Hmm.
one of the things you mentioned earlier is that with congestive heart failure, all your organs are affected, including your brain. And so what happened is that my moods were causing me to not have motivation. And so I focused on improving my moods first. I actually went into a very deep depression, as you can understand, being 36 and suddenly being told I might die. But so I focused on my depression. I realized that was most important. So when I talk to people and helping them, I always look for the emotional reason behind it because that is really what makes the difference between whether you can maintain something or not, whether you think you deserve those changes or not, whether you can, have the strength to tell other
Hmm.
people who are sabotaging you to back off. Those are the things. So I look for those reasons behind the words because why we want to lose weight is often just the surface. There's
Hmm.
something deeper, and I look for that deeper reason. And usually people say, "Oh, because I hurt, my knees hurt, my back hurts." Well, back hurt, knee hurts. Of course, nobody wants to be in
Of
pain,
course.
but when I ask further, usually it is I'm in pain, I'm around people who aren't in pain, and I can't keep up with them, and that makes me feel a certain way. It's rarely about physical feelings, it's more usually about emotional feelings. And so I look for those reasons because that's where the motivation is. And that's where I help people the most. So I do a lot of counseling
Awesome.
in my practice and when working with people. And now I've actually, like, I don't know if I can talk about this now, but I'm so excited. I created a group program because one on one was wonderful, but it was very slow.
Hmm.
And I
Hmm.
just like, I'm a community health physician. I wanted more people, more people, more people. So I did create a group option so that
And
I could help more people.
it's a good idea that you're doing the group option because number one, people can feed off other people's
Hmm.
experiences, and like, oh my goodness, I'm
Yeah.
not alone in this. I find that to be very, very helpful.
Hmm.
Knowing that you're not
Yes.
only going through this challenge, and knowing that people are there rooting for you and supporting you as well. So
Yeah.
that is big, and I love that you do the root cause analysis. You're finding out like
Yeah.
why is this an issue, and why now? Why do you want to make the changes now? Because it would make it even sustainable. So it's not just
Hmm.
losing the weight once, it's keeping it off too. So those
Yes.
questions are important. So I love what
Yes.
you do, Dr. Toomer. All right.
Thank you.
My next question, food cravings.
Hmm.
And before I
Yes.
ask this question, one of the things I have challenges with or in conversation with patients is I
Hmm.
almost feel bad telling them to cut down calories or change this or change that because part of the desire or part of feeling like you're living a good life is good food. No,
Yes.
so
Hmm.
it's like a self soothe. I got home
Yes,
from
it
work. It
is.
was a long day. My boss was a little mean, or I had
Hmm.
an altercation with someone, and I just need something quick to make me feel good. And food
Hmm.
is it. So
Yes.
we're going in the season of holidays. We had Thanksgiving,
Yes.
Christmas, New Year's, and
Hmm.
indulgences are almost valid, right?
Yeah.
So
Yeah.
how do you address doc, like I had a patient tell me that I wasn't being nice, that I wanted him to die if he was to change his food because we
Yeah.
related to culture where red meat
Hmm.
is a big deal and white rice is like a sign of the
Hmm.
life, good life. And
Yes.
so
Hmm.
he was saying at this age it was almost mean for me to
Hmm.
say that he should change. So how do
Yeah.
you address the food cravings and the indulgences
Okay.
that come with the
Hmm.
holidays, the
Days.
night?
Okay. Okay. Well, first, I'd like to say that I grew up in East Africa, where men being big was a sign of wealth and
Yeah.
power, and so I get that size. That wanting to be big, and Bwana Mkubwa. That's the name of men who are powerful, but it's not a very healthy place. People also didn't have very long life expectancy either. That's changing now, but at the time, like I said, I'm 56, so that was a while ago. However, this time of year, one of the things we talk a lot about is emotional eating. And we often tie sadness, stress, and those type of things to emotional eating. During the holidays, it's actually there's the other side of emotional eating, the social happy eating that happens because you're around a lot of people, you're having a good time, and you
Yeah.
just want to keep that good time going with foods that you enjoy. So one of the things I do, rarely, rarely, rarely do I ever tell anyone not to eat something.
Hmm.
What I'll do though is tell them how to eat it in a way so that it doesn't cause them problems or how to limit what it does. Now, the key is if you know that something triggers you and it's something that you tasted and you just can't stop eating it, just to stay away from that. But replace it with something else that's close, that you enjoy, but doesn't have that same effect. The other is use protein as an appetite suppressant. Protein is the most natural appetite suppressant there is. So before eating anything else, just eat something that's protein. Either drink a protein shake on your way to a party, drink a protein shake, right before you're about to serve something, or when you're serving something, make sure there's something that's protein that you can eat first before eating anything else. Because what that will do is fill you up. It will suppress your appetite. And even though you might be emotionally eating, it actually slows you down. And so, and then the other thing I say, people say, well, how can you help me stop emotional eating? Probably not.
Hmm.
That's a pattern we develop often from childhood. Now, it's much quicker to say, okay, rather than trying to stop your emotional eating, just change what you eat when you're emotional. That's easier than stopping the emotion. First, change what you eat when you're emotional, and then we'll work on the reasons why you're doing it. Because that takes a lot longer. It took a long time to develop that pattern. It takes a long time to get rid of that pattern. But what you grab is very, you can change that with one shopping trip. And so, this time of year, the thing to do is, if it's in your own home, you can control what's there. So make sure you have things that you can snack on all the time and not have as much of a problem. Low carb foods like cheese balls, you know, dips, lots of vegetables around that are crunchy, and, so you can just keep chomping all day long and it's not going to cause you a problem. If you're going to someone else's house, offer to take something with you, like a charcuterie board or some other type of thing that you can snack on and eat, that's not going to be as much of an issue. And if it's at the office, if it's someplace you control, and I know in medicine we get a lot of drug reps coming in saying, oh, we're going to bring you food and we're going to do these things. I always say, if they're going to bring something, ask them to bring Mexican food or Mediterranean, because those are foods that are in lots of different sections, and you can limit the amount of carbohydrate and fill up on the proteins. And during this, and usually when that type of eating, you don't have to pay as much attention to your calories, but to the carb content. And the other thing that I tell people this time of year, if you're in a weight loss process, don't beat yourself up if you don't lose any weight. Just prevent weight gain. If you stay the same through the holiday season, that's the same as losing weight for the rest of the year.
Wow, Dr. Toomer. So I took notes. I don't know those who are watching. I'm taking notes because these are very, very important. And I'm going to highlight some of the things you said, and I'm hoping those who are watching live share with those who you think will find this very helpful. Number one, it's not, you talked about emotional eating. You said that's something that's usually lifelong developed. So it's been a habit developed since infancy. When you're happy, you eat. When you're sad, you eat. And even, I can even relate to cleaning your plate. You have to clean your plate.
Yeah.
Whether you're full, you have to push past the I'm full because you had to empty your plate. So instead of forcing, I got to stop being an emotional eater, it's change what you eat when you're emotional. That is big.
Yes.
You mentioned that when you're the one who's hosting, you can control what's there, right? So it's important to have options that that you can graze on throughout the event. You don't feel like you don't have a lot of options. And if you're going, and this is key, and I say this also because it's a kind thing to do, offer to bring something, because sometimes the people who are hosting feel overwhelmed over the holidays. They get back to work tired. I get to see patients and they're like, it was rough. But if you're going, offer to take something with you that is a healthier option and you can snack on. That was very, very, that's a good one.
And I just add to this? Can I add one thing to that? If you ask, more than likely people will tell you, no, don't worry, I've got this. Just take it. Don't ask.
Just take it.
Come in with a gift. Just come in with the gift. Ooh, I brought this. Because most people will say no, that they don't need help, because either out of pride or either out of whatever reason, people just don't want their guests doing work. Just bring it.
Just bring it. You heard the doc. Just bring it. And then you said this, protein as an appetite suppressant. What I tell my patients is, if you're going somewhere, eat something healthy so you can graze while you're there. I also encourage them that look for other activities there outside of food that you can enjoy. Playing a game, dancing, interacting with folks. But protein as an appetite suppressant, you can eat that first. It keeps you fuller longer.
Yes.
And then you said something. You said, if there's a food that you tend to overindulge in, or you have it's almost like you can't control your craving. It's a trigger for you. So instead of avoiding it, look for a substitute for it that you can kind of indulge in. While you're still kind of master the habit of Yes, 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 yes. And
Yes.
you said when you have the option of people bringing food to you, especially drug reps, during the holidays, ask them
Yep.
to bring you Mexican or Mediterranean foods because you have more
Mm-hmm.
options. You have your proteins, you have your carbs, but you can kind
Mm-hmm.
of pick and choose, and you have more variety
Mm-hmm.
that way.
Yes.
And this was big for me. Don't beat yourself up during the holidays. Really, it's not supposed to
No.
be good times, a time you're enjoying
Mm-mm.
family. What you can focus
Mm-hmm.
on is trying to maintain your weight. So if you're able to maintain your
Exactly.
weight during the holidays, you've actually you're still in the weight loss process because that's the time where we
Exactly.
weight.
Mm-hmm.
Thank you. These are beautiful gems, Doc.
Yes.
And I'm
Yes.
so happy
Can
to
I
hear from
add one more point?
you.
Can I
Yes,
just say
please.
one more point? Because the bottom line is people are going to be dropping off cookies. I mean, we know this. People drop off cookies during the holidays. They drop off. They send these nice, beautiful gift baskets with chocolate and everything. One of the things you can do, if you're not someone who's triggered by those things and you just can't stop eating, and you know that you can get by with eating just one, whatever, keep like vanilla protein shakes around. And so you have cookies and milk, but instead of having milk, you have a vanilla protein shake with it. It will do two things. It will stop you from overindulging, but it will also stop that sugar spike that
Mm,
happens that drives your appetite.
mm.
And so that way you don't have to completely, you know, uh, beat yourself up about avoiding certain things. You can just indulge a little bit.
Awesome. Awesome. Thank you, Dr. Toomer. That was good. That was
Okay.
golden. Next question, habits.
Hmm.
And
Yes.
I always like to discuss this because I, I don't know. I don't think there's a way around it. It's important to develop good habits,
Hmm.
healthier habits. Now, for
Hmm.
effective weight management,
Hmm.
what habits do you think are good to maintain? And let's keep it simple,
Okay.
maybe two or three or
Keep it
four.
simple. Okay.
Yeah.
Well, let me just start off by saying there's no such thing as bad habits. Bad habits are just either immature or mature. They're
Ooh,
not good or bad.
okay.
So, if you have immature habits, just like children who are, babies, they have temper tantrums, they cry, they do certain things, and you may find them uncomfortable, but as they grow up, suddenly their behavior changes. And that's the same thing with habits. And so, all you do, what I did, especially when I lost my weight, I didn't change my habits. I changed within my habits. And I'll
Hmm.
give you an example.
Okay.
Um, and this is something I tell everyone. People always say, one, I don't drink enough water. Hydration is really, really important in a weight loss process. And the reason is when we are dehydrated, our body often confuses dehydration with hunger. And so we'll start craving foods, but you'll start noticing you're craving foods that have high water content. And a lot of those a lot of those substances with high water content also have high sugar content, like fruits and different things. So hydration is important. One of the ways you can drink more water is by adding it to a habit you already have. We all eat, we all snack.
Hmm.
Drink water before eating, before snacking. So that way you're not changing a habit, you're just adding to it. And that's probably one of the most important ones, I would say. The other is the habit of getting on electronics while in bed. Sleep is probably one of the most underappreciated reasons that people gain weight and one of
Hmm.
the best ways to lose weight. When we sleep, our body puts out a hormone that helps with fat breakdown and also affects our appetite the next day. When we don't sleep enough, we're tired. When we're tired, we tend to grab carbs because we think those carbs are going to give us energy.
Hmm.
So sleep is very important. So one of the habits I would recommend is keep your electronics away from where you sleep so that you don't get stimulated and end up not getting as much sleep as you would have if you just were in the dark with your head, down and in a quiet space. So those are
Awesome.
the two biggest ones that have nothing to do with food.
Water. Sometimes you're not hungry, you're thirsty.
You're thirsty.
Sometimes you're not hungry, you need a hug. uh, just saying. I've had to learn that in my own journey. Sometimes it was just I needed a
Yeah.
hug. So learn to ask for those
Yes.
things as a substitute
Yes.
for food.
I
And then
agree.
And for those who are thinking, well, my alarm is on my phone, so I need it to be by my bed. You can put it on do not disturb, so your phone never goes up, no lights up, no alerts, no
Hmm.
dings and pings. Sleep is
Hmm.
very, very important.
Yes. Or stick it
Also,
under a pillow, face down, so that as you
ah,
get messages, your phone doesn't keep lighting up and you kind of letting you know something's there. And turn off, yeah, all your notifications. No buzzing, no pinging, no nothing. And put it under a pillow. You'll hear the alarm. You won't hear
mm-hmm.
anything else.
Turn it off, guys.
Turn
Turn
it
it off.
off.
In the dark.
Yeah.
All right. My next
Hmm.
question. So some people are thinking,
Hmm.
"Well, I'm happy for you, doc. That was easy for you." But everybody's different. Some of these things are
Hmm.
hard. Some
Yes.
people tell me water is like drinking metal. I've
Hmm.
actually had that comment. So like water does not taste like how. So for those who are saying, doc, I don't know, this may not be realistic for me, and this is hard. How would you advise
Hmm.
them?
I would say add something sugar free to that water so that you can enjoy it. It's more important that you get that fluid in some way than not at all. So you can add lemon, you can add lime, you could add, there's lots of different types of sugar-free additives you can put in your water, like Crystal Light, like I think it's called Mio, like other things. And yes, those, people say, well, what about the artificial sweeteners?
Right.
If you're drinking, dehydration is a lot more harmful for you than those sweeteners are. And a lot of those sweeteners that are in there were cause problems in animals. They've never been shown to cause an issue with humans. But dehydration has shown to cause problems with humans. Kidney failure.
Hmm.
When you consider that our blood is 85% water,
Water.
and our blood is what carries all of our nutrients, all of our oxygen, everything that our body needs is goes into our blood first. And that is carried to every organ of our body, including our skin, our eyes, our brain, our kidneys, our toes, our fingers. If you're dehydrated, all of it gets affected, your digestion, your everything. So it's more important to be hydrated than it is to worry about, what exactly you're drinking. Except, you want it to be sugar free and you want it to be, um, usually what the way to figure out how much you should drink is you take your body weight and you divide it by two, and that's how many ounces you should
Water.
drink a day, up to a gallon. Now, anything more than a gallon is just too much. And, I don't drink that much. I can't also because of heart failure. There's a reason, people in heart failure can't drink a lot of water. But even if there's no other reason to limit your fluids, then half your body weight in ounces.
Awesome, awesome. And of course, these are medical suggestions. Please schedule time with your
Hmm.
primary doctor to have a
Exactly.
personalized advice for you. But these are very,
Hmm.
very, very, very powerful information, Dr. Toomer. I'm so happy that you're here. So just to summarize, I want you to give us
Hmm.
4 tips. We already talked about many, but 4 tips
Hmm.
on how to keep the weight off beyond the holidays.
Okay.
You can feel free to repeat some of the things you said, but just 4 as we're wrapping
Hmm.
up.
Hmm.
Yes.
Okay. One, do not underestimate the emotional impact of post holiday blues. Pay attention to that. Use exercise as a way, or movement, I should say, as a way of countering that. It does not have to be, exercise necessarily. It can just be dancing. It can be, spinning and singing at the top of your lungs. Whatever it is that distracts you and gets your mood better, do it. The other is don't underestimate the impact of protein on an appetite. Use it. I can't tell you how many times I get asked to prescribe Adipex, and I say no. Just eat protein instead. Most of us don't eat enough protein. And so just adding protein to every meal and snack will do it. Your appetite will drop. I would say the third would be also, if you can, use muscle as your medicine. Muscle is the gift that keeps on giving when it comes to weight loss. You just constantly burn, and you're constantly, and it not only does it burn calories, it also creates this sense of well being. You're stronger, you feel better, but also it protects you from falls. It protects you from, helps you keep your balance. And so, depending on your age, depending on whether you have bone issues, depending on whether you have joint issues, having stronger muscles could be the difference between being able to walk when you're 80 or being in a wheelchair. So,
Hmm.
get that muscle while you can. And I would say the fourth one is give yourself grace and be patient. We tend to beat ourselves up a lot, and we tend to talk about ourselves badly when we're not doing something that we think we're supposed to be doing. Our brain cannot tell the difference when we're being bullied by somebody else or
Oh,
being
wow.
bullied by ourselves. It
Wow.
reacts with the same stress reaction. Stress changes what your body does with food. When you eat, your food either becomes fuel or fat. If you're under stress, it shifts it to fat. And so it's really important to be kind to yourself. That will change what your body does when you eat, no matter what you eat.
Wow. That is profound. Your body, your brain does not know the difference from when it's bullied by others, but when it's bullied versus when it's bullied by
Hmm.
you, but what you're saying to
Hmm.
yourself. Wow,
Exactly.
that is
If
profound.
another person insults you, you immediately know you're being insulted and you immediately react and you know that's not a good thing. But we'll say stuff to ourselves that's far worse than anything someone else will say to us.
Wow, wow, wow. That is profound. That is profound. Be gracious to yourself. Allow grace
Yes.
and be patient
Hmm.
with the process.
Yeah.
I think that method is more, it gives long lasting results. You not only
Hmm.
look good, you feel good. You feel
Yes.
as good as you look. And
Yes.
that is key. Thank you, Dr. Toomer. I'm going to
You're
have you on.
welcome.
I'm going to have you on again. This was good. This was good. And so thank you so much. And for those
You're
who are
welcome.
watching, who are like, man, this doctor is amazing. How can I get her to come speak at a conference? How can I get
Mhm.
in touch with her? Where can people find you?
People can find me at drtoomer.com. That's drtoomer.com. And you can find me on Facebook. You can find me anywhere. I'm the only Dr. Catherine Harmon Toomer on Google. So you can find me anywhere.
Awesome, awesome. And
Yes.
I'm going to put the link. I'm going to put the
Hmm.
link to your website as well as to your Facebook page on the
Hmm.
post when we're done with this live. Thank you so much, Dr. Toomer. You were awesome.
Hmm.
I love what you do, and thank you all
Thank
for
you.
watching. If you're watching this
Thank
live, I
you.
should have said this earlier. Hashtag live. But those who are watching the replay, go ahead and hashtag replay. Thank you for being here. And if you or
Yes.
anyone you know is looking for an awesome, passionate, caring, and thorough family physician in the Mansfield, Texas area, I am she. Thank you so much.
Yes. Yes, you are. Bye.